When you were a kid and you're running around outside in the snow and your parents yell at you, "Come inside before you catch pneumonia." What is pneumonia? Can you really catch it?
Pneumonia is an infection in one or both lungs in which bacteria, viruses, or fungi enter the respiratory tract, making it hard to breathe.
There are over 30 different ways you can acquire pneumonia. Most healthy people recover from pneumonia in 1 to 3 weeks, but it can be life-threatening. Understanding the cause and type of pneumonia you have is important because your treatment depends on it. There are 2 main types of pneumonia.
The 2 main types of pneumonia are lobular pneumonia and bronchial pneumonia. Lobular pneumonia affects a single lobe of the lung and is commonly caused by the bacterium Streptococcus pneumonia. This bacterial infection can spread into the bloodstream by the gas exchange in the lungs and affect other tissues. On the other hand, bronchial pneumonia affects patches of both lungs around the bronchi or the bronchioles. The main function of the respiratory system is to ensure that oxygen is carried into the body for the use by cells and that carbon dioxide is brought out of the body to prevent waste buildup. The overall process of this is called respiration, which can be divided into 4 stages. The first stage is breathing, and it involves 2 basic processes, inspiration and expiration. Inspiration takes in oxygen from outside of the body, and expiration carries it back out. An individual with pneumonia may find it difficult to perform these processes because of the infection affecting the second stage. The second stage is external respiration, which is when the gas exchange of oxygen and carbon dioxide takes place inside the lungs. Inside the little air sacs in your lungs, called the alveoli, oxygen is taken into the bloodstream for the use by cells. In a healthy individual, the oxygen from the air is brought in the lungs and into the alveoli, where it diffuses across the thin layer called the epithelium and into the capillaries. This oxygenated blood then goes back to your heart, then the rest of your body. While this takes place, carbon dioxide from the deoxygenated blood in the capillaries diffuses into the alveoli to be expelled from the body by exhalation. Pneumonia inhibits the alveoli to efficiently diffuse the oxygen and carbon dioxide across the epithelium, since the infection causes a lining of mucus, fluid, or pus to form along the inside wall. This prevents carbon dioxide from leaving the bloodstream and makes it harder for the inhaled oxygen to enter the bloodstream, leaving the body starved for oxygen. This then affects the next 2 stages of respiration, internal respiration and cellular respiration. Internal respiration is the gas exchange between blood and body tissues. Cellular respiration is the gas exchange between individual cells.
There's many ways you can get pneumonia. It's airborne and usually follows the flu. The flu makes it harder for your lungs to fight infection, so it makes it easier for you to get pneumonia. Having long-term or chronic diseases like asthma, heart disease, cancer, or diabetes can also make you more prone to get pneumonia.
Bacterial pneumonia is the most common type of pneumonia in adults. It may cause a fever as high as 105 degrees Fahrenheit, along with sweating, bluish lips and nails, and confusion. The most common causes of bacterial pneumonia are Streptococcus pneumoniae, Chlamydophila pneumonia, and Legionella pneumophila.
Pneumonia can also be caused by fungi from soil or bird droppings, which occurs when people exposed to fungi inhale large amounts of the organism. Fungal pneumonia is more common in people with chronic diseases or weakened immune systems. People with AIDS have a weakened immune system and can often experience a kind of fungal pneumonia called Pneumocystis jirovecii pneumonia.
Viral pneumonia is a respiratory virus that young children and older people usually get. Viral pneumonia is usually not that serious, and it lasts a shorter amount of time than bacterial pneumonia.
Mycoplasma organisms are neither viruses nor bacteria, but they have traits common to both. Mycoplasmas normally cause mild cases of pneumonia, which are most often found in young children and adults.
While having pneumonia, you will most likely cough up mucus, also known as sputum, from your lungs. Mucus may be rusty, green, or tinged with blood. You'll experience headaches, loss of appetite, mood swings. Your skin will have a blue tinge and will feel clammy. You'll have a low blood pressure, but you'll have a high heart rate. You'll experience chills, joint pain, muscle aches, and fatigue, and you'll have a high fever, feel nauseous, and feel like vomiting. You will also cough up sputum and phlegm. Phlegm is a thick substance that is secreted by the membranes of the respiratory passages.
Apart from the lack of oxygen in the bloodstream, pneumonia can also affect the rest of the circulatory system by putting strain on the heart. Having pneumonia puts one at a higher risk for getting a heart attack, even after recovery. If there is not enough oxygen in the blood, the heart will try to pump faster to get as much blood containing oxygen to the rest of the body. A pneumonal infection can also spread from the lungs and into the bloodstream. The spread of bacteria is called bacteremia and results in septic shock. Septic shock causes a low blood pressure and a reduced oxygen flow to the body's major organs. When the organs have too much carbon dioxide and not enough oxygen from the blood, they become damaged and eventually shut down.
Pneumonia not only affects your respiratory and circulatory system, it affects your digestive system. While having pneumonia, you might vomit and feel nauseous.
Hospital-acquired pneumonia is acquired during a stay at a hospital. It can be more serious than other types of pneumonia because the bacteria involved can be more resistant to antibiotics. Ventilator-associated pneumonia is when people who are using a ventilator get pneumonia. Community-acquired pneumonia is acquired outside of a medical or business-like setting.
Aspiration pneumonia is a type of pneumonia that is acquired when bacteria is inhaled into the lungs from food, drinks, or saliva. This is more likely in people with swallowing problems, but can also occur when something is swallowed too fast or not properly, which risks the possibility of bacteria entering your trachea and infecting the rest of your lungs. To verify that a person has pneumonia, the doctor will start by asking the patient about medical history and by doing a physical exam, which includes listening to the person's lungs with a stethoscope to check for abnormal bubbling or crackling sounds that might suggest pneumonia. If pneumonia is suspected, the doctor will recommend some other tests.
A chest x-ray is normally recommended if a doctor suspects that you have pneumonia. This helps the doctor diagnose and determine the extent and location of your infection, but it cannot tell the doctor what kind of germ is causing the pneumonia. If a doctor suspects that you have pneumonia, he or she will recommend that you have a blood test done. This will confirm if you have an infection and identify the organism that is causing the infection. This will also check your white blood cell count.
A sample of fluid is taken from the lungs and then analyzed. It is taken after the patient takes a deep cough. The fluid itself is called sputum.
Pulse oximetry is a test that measures the oxygen levels in your blood and can also detect how efficiently oxygen is being carried throughout your body. An oxygen saturation level of 95% is normal for most healthy individuals, and a level of 92% indicates potential hypoxemia or deficiency in oxygen reaching tissues in the body. This might indicate that not enough oxygen is being diffused into the bloodstream through the alveoli, which is a symptom of pneumonia. If the initial symptoms of pneumonia are severe, a bronchoscopy will be performed to observe the condition of the inside of the lungs. A bronchoscopy is a test that looks into the airways of the lungs by using a camera on the end of a tube that's gently guided down the throat and into the lungs.
Treatment for pneumonia involves curing the infection and preventing any further complications. People who have community-acquired pneumonia can often be treated at home with medication. An option that is most commonly used in order to treat pneumonia is antibiotics.
Another good way to treat pneumonia is by resting. Going sick with pneumonia to work is not a very good idea. In 1977, doctors and scientists discovered the pneumococcal conjugate vaccine, also known as PCV. This vaccine has now been used worldwide to combat and cure pneumonia. In Canada, there are many institutions that give this vaccine. Other ways you can prevent pneumonia is by getting the flu shot and always washing your hands. Drinking excessive amounts of alcohol and cigarette smoking are the two strongest risk factors for pneumonia in a healthy young person. Having also recently had the cold or the flu increases the chance of you getting pneumonia. Taking medicines like Prilosec or Tums, medicines that reduce the amount of stomach acid, also increases the chance of you getting pneumonia. Why is researching pneumonia so important? Researching global health risks should not only provide knowledge, it should encourage action. Pneumonia is a leading cause of death in children in many underdeveloped countries, even though it can be treated with antibiotics. Pneumonia, diarrheal diseases, tuberculosis, and malaria, when combined, have estimated to account for more than 20% of the diseases in the world, yet they receive less than 1% of total private and public funds which are devoted to health research. In Canada, in 2015, 38 children under the age of 1 died. Adults between the ages of 75 and 84, over 1,469 Canadians died. In total, 5,452 Canadians died because of pneumonia. In 2015, worldwide, 920,136 children died because of pneumonia. Pneumonia is more prone to children of African descent than to children of European descent. Scientists and doctors are still not sure why this is happening. After the introduction of the pneumococcal conjugate vaccine, also known as PCV, the pneumonia rates were decreased in both Canada and America. Thanks guys for watching. This video is inspired by ASAP Science. So yeah, we kind of know it looks like an ASAP Science video because it's supposed to kind of look like that. Yeah. Oh yeah, thanks Ben for helping us draw. Okay, bye!